Hello, this is Sudharshan, and in this episode PA 24.7, we will talk about colorectal cancer. So, as the name suggests, it is a cancer that is going to affect the colon and the rectum, so basically the large intestine. So next, if we see the risk factors, so it can be lifestyle issues like improper diet, and along with addictions like alcohol, smoking, any comorbidities like diabetes, hypertension, obesity, or you can say dyslipidemia, sedentary lifestyle like not exercising properly, sitting in one place only, and any history of the disease or the socio-economic status. And with the age, it can occur as the age increases, the risk will be more. And with the complications, we can have iron deficiency anemia. This is because if the tumor is invading the blood vessels, it can cause the damage to the blood vessels and blood can spill out. So it can lead to iron deficiency anemia. And obviously because of the tumor, the normal appearance of the bowel is affected. And then the tumor can have hemolymphatic spread via the lymph nodes and the bloodstream. And also it can lead to peritonitis, where there is infection of the peritoneum because of the microbial infections. And with the clinical features, generally asymptomatic, patient don't experience the symptoms. There will be other symptoms like fatigue, anorexia, that is loss of appetite, then weight loss, GI distress. Then apart from that, bleeding, rectal bleeding can occur, bowel obstruction. And then coming to the diagnosis, we can go for imaging to detect the tumor. Biopsy studies can also be done. And then we can have the labs showing elevated CEA or carcinoembryonic antigen, and also fecal occult blood test. This is very important for colorectal cancer. Fecal occult blood test to test for blood in the stool, and also digital rectal exam to see any lesions are there in the rectum. Yes, and apart from that, the treatment, we have chemotherapy and radiation therapy, along with surgery also. So apart from that, there is also mechanisms for the colorectal cancer. So two pathways, mutational pathway and microsatellite pathway. So before that, morphologic progression, let us see. So initially there is early adenoma. So initially the tumor will be enlarged. Then it lead to dysplasia. The cellular growth will be affected. There will be papillary projection, that is the folded epithelium. Then the adenoma, which is very small, it starts growing in size, becomes a tumor and invades the entire intestinal wall. And the two pathways, as I said, one is the mutational pathway. Very commonly beta-catenin mutation, APC loss, that is adenomatous polyposis coli, that lead to mutation in the KRAS, and that causes the loss of P53, which is a common oncogene or a tumor suppressor gene. And microsatellite pathway, here mutations are more. Yes, and here DNA repair genes are affected, as we see in hereditary non-polyposis colon cancer, HNPCC, which is also called Lynch syndrome. That is mostly an autosomal dominant condition. And because of DNA repair genes, whatever DNA sequences are affected, we cannot replace them back. That is why the DNA sequences will be irregular. And this thing. So we have right versus left-sided colon cancer. Let us see. So right-sided colon cancer is common in the cecum and the ileocecal valve, which is a connection between the ileum and the cecum. And whereas the left-sided cancer, if we see in the descending and sigmoid colon. And then grossly we can see for the right-sided cancer, It is polypoid, so it looks like a polyp and somewhat fungating. So cauliflower-like appearance of the tumor. And left-sided napkin ring, very important, okay, napkin ring appearance. And with the pathogenesis, right-sided is intraluminal, whereas left-sided is intramural. So that means the entire inner wall is affected in left-sided, whereas intraluminal is due to some liquid in the empty space that is there. And very commonly they present as GI distress, bleeding, constipation, all that. And there will be a palpable mass also based on the site affected. And with the prognosis, it's more challenging to treat right-sided colon cancer than left. And that's why the patient should be undergoing the psychological counseling. That is, we give assurance to the patient that he will be all right. So that is all with the colon cancer. So thank you so much. We'll see in the next lesson.